Bismillahirrahmanirrahim. In discussing the disorders of the skeletal system, today we will discuss the Paget disease of the bone, which is also known as the osteitis deformans. The Paget disease of the bone results from uncontrolled bone remodeling, with the result that it will lead to the formation of immature, weak, woven bone which is susceptible to fractures and may lead to deformities. Sir James Paget described many diseases, and the two most important diseases described by the James Paget, who was a pathologist and a surgeon, is the Paget disease of the bone, which results from uncoordinated and unbalanced bone remodeling, resulting in the formation of bone which is abnormally shaped, weak and brittle, and susceptible to fracture and deformities. The other common disease described by the Paget is the Paget disease of the nipple, also known as the Paget disease of the breast. This is a rare condition and it is associated commonly with the carcinoma of the breast. Now, we know that bone is not an inert structure, but actually it is a dynamic structure and it continues the process of bone remodeling, in which the osteoclasts, which are the cells that digest bone, cause bone resorption, and it is followed by the osteoblasts that secrete the osteoid seam, which consists of type 1 collagen, and that provides a scaffold for the deposition of calcium and phosphate, and in this way new bone is formed. On the cellular level, the osteoblasts, which are derived from the osteoblastic progenitor cells, they secrete the rank ligand, which is receptor activator for nuclear factor kappa B. On the osteoclasts, there are rank receptors, and the interaction of the rank ligand with the rank receptor causes the osteoclast to differentiate and it gets activated. The macrophage colony stimulating factor is also released by the osteoblast, and it helps in the differentiation and activation of the osteoclast. Now, the mature osteoclasts, upon activation, then start to release the enzyme collagenase and hydrochloric acid. The collagenase degrade the collagen contained in the bone, and the hydrochloric acid cause demineralization by dissolving the hydroxyapatite, which mainly consists of calcium and phosphate. So in this way, the process of bone resorption continues. When a sufficient amount of bone is resorbed, then the osteoblast secrete another factor known as the osteoprotegerine. The osteoprotegerine will bind to the rank lesion, and it will prevent the rank lesion from activating the binding to the rank receptor and activation of the osteoclasts. At the same time, the osteoblasts secrete the osteoid seam, which is composed mainly of type 1 collagen and mucopolysaccharides, and this osteoid seam provides a scaffold upon which calcium and phosphates are deposited, and the process is known as the mineralization, and it will lead to the formation of new bone. But it is important here to say that the two processes are very well controlled and tightly regulated. Any imbalance in the process of bone resorption and bone formation will lead to problems, and it will lead to the formation of new bone which is misshapen and prone to deformities and fractures. And the same is the situation that happens in Paget disease. In Paget disease, initially there is accelerated bone remodeling, which consists of excess bone breakdown or bone resorption by the osteoclast, which is followed by excess bone formation by the osteoblasts, and finally, in the sclerotic phase of the disease, there is the formation of misshaped, immature, weak, woven bone with increased susceptibility to deformities and potential fractures. Now, coming to the etiology of the Paget disease, the exact cause of the Paget disease is unknown. However, studies have proved that the Paget disease can be triggered by infections like measles viruses and paramyxovirus. Moreover, the Paget disease is linked to the genetic mutations like SQSTM1 mutation, and this is the gene which encodes proteins that are involved in regulating the osteoclasts. So a person with this type of mutation is more susceptible to develop Paget disease. The Paget disease may involve a single bone or a part of a bone, in which case we say that this is monostotic disease. Or sometimes it may involve the whole skeletal system, and in that situation we say that this is the polystotic disease. Paget disease may involve any bone, but most commonly it involves the skull bones, the lumbar vertebrae, the pelvic bones, and the femur. We divide Paget disease into the well-defined three phases. The phase 1 is the latex phase, which is characterized by excessive activity of the osteoclast, and it leads to excessive bone resorption and demineralization. The second phase is the mixed phase, and by that we mean that bone resorption continues, but in addition to the bone resorption by the osteoclast, there is osteoblastic activity, and the osteoblasts lay down new bone, but this new bone is weak and misshapen. So in the mixed phase, there is unbalanced osteoclastic activity plus osteoblastic activity. In the third stage, known as the sclerotic phase, the new bone formation by the osteoblasts it exceeds bone resorption. And the new bone that is formed in a haphazard way, and the process is unbalanced, and with the result that the newly formed bone is structurally disorganized, weak, and susceptible to fractures and deformities. The sign up and symptoms of the Paget disease are that in the early Paget disease, usually there are no symptoms. And we may come to know incidentally by examining the radiographs, and for example, if a patient is presented with a fracture. So early in the Paget disease, the patient is symptomless. However, the Paget disease may lead to misshaped bones, and these misshaped bones in the advanced disease may lead to overgrowth of the skull bones, and the appearance of the person's facial expression is that of a lion, and it is known as the leontiasis. The misshaped bone may impinge nerves, and it may lead to pain, and the patient may complain of the pain. Moreover, the impinging of the auditory nerve in the auditory meatus may lead to loss of hearing, and the optic nerve in the optic canal, the misshapen bone may impinge the optic nerve, and it may lead to loss of vision. Due to involvement of the vertebrae of the vertebral column, which become weak and misshaped, there may be excessive curvature of the vertebral column and spine, with the person looking down to the ground, and this is known as the kyphosis. The vertebral compression in the spinal cord, as well as the misshapen bones in the pelvis, which cause pelvic asymmetry, it may lead to weakness of the lower limb muscles, and the pressure on the bones of the legs may result in the formation of bow legs, with the knees extending outward. This is also known as the genoverum. If the Paget disease involves the bones that take part in the joints, it may lead to inflammation of the joints or arthritis. 1% of the cases of the Paget disease, the excessive bone resorption and bone formation may lead to genetic mutations and may cause osteosarcoma, which is osteogenic sarcoma, also known as the Paget sarcoma. To summarize the manifestations of advanced polystotic Paget disease, it may lead to curvature of the vertebral column and spine, known as the kyphosis, the thickening of the skull bones, and the person may need a large size of hat to wear. Deafness and loss of vision due to impinging of the nerves in the auditory meatus and optic canal, and the bone that undergoes quick and rapid remodeling may need a high amount of blood, and which may lead to increased cardiac output due to high vascularity of the bone, and in severe cases it may cause high output congestive cardiac failure. There is bone pain, most commonly in the back, hips, and the pain that radiates from the pelvis and back side of the, from the vertebral column to the lower limbs. There may be weakness of the lower limb muscles with extension of the knees outwards and the formation of bow legs. Since there is accelerated bone remodeling and the new bone formation need blood, so we may feel warmth and tenderness over the bones. To summarize the clinical course of the Paget disease, we know that usually it follows a benign course, and most of the times uh, in the early stages Paget disease may be diagnosed when incidentally when we see changes on the radiographs. 1% of the Paget disease patients may develop osteogenic sarcoma, and the vertebral lesions may cause back pain and disabling fractures and nerve root compressions. And when we look over the long bones in Paget disease, they may get deformed, and the excessive bone remodeling may lead to hypervascularity and the high output congestive heart failure. And in the proliferative phase, the disease that when it involves the skull, the common symptoms are the nerve impingement, and there may be headache, visual and auditory disturbances. And in Paget disease, the serum alkaline phosphatase level will be elevated, and there will be increased urinary excretion of the hydroxyproline. And these two findings, they reflect the excessive or exuberant bone turnover or bone remodeling. The diagnosis can be made by high levels of the alkaline phosphatase, which is a very important uh, enzyme involved in bone remodeling, because it will hydrolyze. Since it is a phosphatase enzyme, it will hydrolyze the natural uh, inhibitors of the bone formation. The X-ray may show latex lesions during the latex phase, the number one phase, and of the Paget disease, and it may show thickness in cortical bones. Uh, we may also get help from the bone scans, and we may do bone biopsy, because many symptoms of the Paget disease may mimic osteogenic sarcoma. So to exclude the presence of the malignancy, we may need bone biopsy. There is excessive latex lesions in the bone, then can be seen on the radiographs. The treatment of the Paget disease is to kill the pain by using painkillers and to inhibit or slow down the bone resorption. And the drugs bisphosphonates can be used to slow down the breakdown of the bone and bone resorption. Sometimes we may need surgery to correct bone deformities and to decompress impinged nerves and to reduce fractures. So, in summary, we have studied that the Paget disease consists of three phases: the lytic phase, characterized by excess bone breakdown or bone resorption; in mixed phase, where there is lytic activity along with the blastic activity and there is bone resorption as well as bone formation; and the sclerotic phase, which is characterized by exuberant bone formation; and then there is a dormant phase also. Initially, Paget disease may be asymptomatic, but later on, the misshaped bones can lead to nerve compression and fractures, and The Paget disease may result from paramyxovirus or measles virus in genetically susceptible persons, particularly with genetic mutations of the QSTM one gene mutations, and it is caused by the disease. Paget disease is caused by aberrant and excessive osteoclastic activity followed by exuberant but structurally unsound new bone formation, which is known as the osteoblastic deposition of the bone. Thank you very much.